Good afternoon. It is April 15th, and this is the one-year look back COVID-19 Maryland Food Access Team webinar. This webinar is being recorded and only predetermined presenters can speak. Everyone else has been muted. If you have a question you would like answered, please drop it into Q&A. It will be addressed via email later or in the next webinar. Presenters, please remember to speak slowly and clearly. I'll unmute you when it is your turn to speak. Rachel, thanks for all your hard work. I'm going to hand it off to you.
Thank you, Seth. Thank you for all of your hard work as well. And thank you for joining us again for our 34th Maryland Food Access Response Team webinar. We have held this call every other week to provide you with the latest news and information about the COVID-19 food response in Maryland, as well as give you best practices on how to continue to provide critical food assistance and resources to the clients who depend on you. This week, we are going to do something a little bit different. For this call, we will be reflecting on 1 year of COVID-19 response. My name is Rachel Ventura. I am here as moderator of this call and in my role as Partner Services Engagement Specialist at the Maryland Food Bank. Today, we'll hear from members of the Maryland Food Bank senior team, Carmen Delguechio, President and CEO, Meg Kimmel, Executive Vice President and Chief Strategy Officer, Sue Zavoynia, CFO, Rick Condon, SVP of Operations, and Nikisha Boyer, SVP of Programs. We will also hear from DHS and MDH on this call. Kyle Shannon and Bethany Brown will be presenting. The following Maryland Food Bank directors will also be presenting: Emily Alt, our Senior Director of Programs, Jennifer Small, Senior Regional Program Director of Eastern Shore and TFAP. Also, MFB staff helps produce and manage this webinar. At the beginning, you heard from Seth in our IT department who handles the technology for these webinars. A few things to note for today's call. Since this is a special edition webinar, we will not have a live Q&A session at the end of the webinar. If you have questions, please email us at mdfoodresponseteam@mdfoodbank.org. First up, we have Meg Kimmel. Meg?
There we go. Sounds like I'm in the game, right?
Yes.
Terrific. So hi, everyone. This is Meg Kimmel. As Rachel mentioned, I'm the Chief Strategy Officer at the Maryland Food Bank. I've been on this call many times over the past year. I'm really glad to have the chance to be here with you today. I was reflecting and thinking about this webinar, and the theme that kept popping to mind for me was remember when. I know the experience of this past year has been unforgettable for you. I so clearly remember the early days when we weren't sure what was coming, but we knew that it was going to be a seismic shift in the work we do in communities statewide. I can still remember waiting for the phone call that confirmed that first stay-at-home order, and that changed everything for us. I'm wondering how many of you were on the first call that Bethany Brown organized. Several of us here were on that call. The idea being to share information with you. And so Bethany and Deanne were presenting and talking to you about how to stay open and stay operational. And then Bethany said, does anyone have any questions? And she hit unmute and a roar erupted from the phone. You all had questions at the same time, and we didn't even have a technology solution to address those. So we switched over to this webinar format, and we've been here ever since. But you needed to know things. Like, were feeding programs even able to stay open during a stay-at-home order? And how are we going to navigate the supply chain challenges? Would there be food to distribute? How could we distribute that food and keep our clients and our volunteers and our staff safe? We didn't know the answers, but what we did was we worked together a little bit and made a little bit of progress every week, a little more progress every month, and over time, we've made it to today. So I'm going to go out on a limb here and assume that you're all pretty tired from the work of the past year. I know that certainly the team at the food bank has been working really hard and is feeling the same way. And at the same time, I know that the work that lies ahead of us is no less daunting than what we have been through over the past year. And so what we'll do, we'll just keep doing what we've done. We work together, we make a little progress every week, and we keep working together to make a difference. So our work as a food bank has changed so much. You think about looking back over the past year, and it's kind of remarkable for us. Having been at the Maryland Food Bank for more than 8 years, the shift that's happened over this past year is nothing short of remarkable. We are now distributing food that we are largely purchasing, and that's happening at no cost to you. That's a sea change from where we were before COVID. We're working with you, and we're working with local counties and cities across the state. We're working very hard to make sure that the issue of food insecurity never becomes yesterday's news story. And we're fundraising so that we can pass those funds on to you through grants and through continued access to food at no cost. We're also calling attention to issues of systemic injustice and racial inequality as a key part of our work to solve hunger for more Marylanders for good. So along the way, one of the things that was very intentional on our part at the Maryland Food Bank is that this network was our priority. We never wanted to see scenes like the ones that we saw on the evening news from Dallas or Pittsburgh, lines of cars, people lining up directly to get food from the food bank. We didn't want to do that. We wanted to keep this network up and running. Deanne, in that first call, coined the phrase, stay open and stay operational, and we've been using it ever since. We wanted to provide you, and we want to provide you with good quality, nutritious food so that as people turn to you and your programs, you can sustain both their bodies and their minds. So over the course of this past year, we have distributed more than $23 million in grants and food to this network. So I think that's a moment to celebrate. Unfortunately, there's been a need, but I think the fact that we've been able to work together to make that happen is nothing short of incredible. So as we look forward, our focus is going to be on two things. One, to build a stronger food system, and also to build a stronger food assistance safety net. And we're going to need both in the years to come, because across the state, the need is much greater today than we even could have ever imagined just a year ago. And the impact of our collective efforts, the work that we do to make sure that everyone in Maryland can access good, nutritious food, we'll need more of that as we want to help our neighbors get back to work, get back to school, get back to life. We're honored to be part of this journey with you. Thank you, and we look forward to being a great partner in the important work that lies ahead. I'll pass it back to you, Rachel. Thank you.
Thank you, Meg. Next up, we have Rick Condon, our Senior Vice President of Operations. Rick?
Thank you, Rachel. I can't believe that we're a year into the pandemic, and the look back shows us the work that all of us on the call have accomplished. I want to take a moment and set the table on monthly purchased and donated product movement from Maryland Food Bank the 12 months prior to the outbreak of COVID. We traditionally averaged 2.1 million pounds of inventory to start a month and moved out about the same, or 2.1 million pounds of food. As news of COVID began, in late February, we decided to begin ordering more of the top 10 items in anticipation of growing need and potential supply chain issues. Upon Governor Hogan announcing stay-at-home orders in March, almost instantaneously, our network partners pulled down 1.5 million pounds of donated food for an increase of 57% over the average. By the end of March, the need of our partners outstripped our available inventory, and we quickly found ourselves meeting shipments with inbound volume. March found us supplementing inventory with over 600,000 pounds of inbound product. To meet the need beyond our traditional partners, we began building backup boxes. In March, we distributed 1,577 backup boxes. As we moved into April, there was real concern about the ability to meet the need. The supply chain was lengthening as lead times went from 14 days to 46 days. Partners had pulled through all quality donated, shelf-stable foods, and the inbound purchases began to slow. Analysis showed that we're about 2.5 weeks away from not having enough food to meet the required need. We saw a 91% increase in the consumption of purchased items compared to our prior year average. Additionally, we quickly stood up a packing site to build the backup box. As the need for food grew, so did the backup box volume. We distributed 17,700 boxes in the month of April. May found inventory levels and the menu variety still suffering. Supply chain continued to stretch. Products that had been ordered in March were finally starting to arrive. May saw the beginning of the CFAP distributions for near 1/2 million pounds. The BUB need continued, and we started distributing what became an average of 36,000 boxes a month. By June, inventory began to build, but the menu remained very weak. Supply chain had not yet returned to normal, and demand remained high. Our sourcing team kept pressure on suppliers to keep us to get us product. CFAP hit a full month of distributions with 1.5 million pounds of good, healthful produce, dairy, and meats into the network and partners. Finally, in July, those products that had been ordered in April and May began to land and allowed us to begin to build a more robust menu with an increased inventory level of 1.5 million pounds beyond our distribution. Hurdles that we saw over the early days of our response, the supply chain grew from 14 days to over 70 days at one point. There were vendor limitations. We may all remember the lack of available peanut butter, pancake mix, and shelf-stable milk as those plants shut down. As these type of events rose, Maryland Food Bank sourcing team turned to our partners at Giant, ShopRite, Wakefern, and other non-traditional suppliers like Cisco and US Foods to source replacement items as best we could. The participation of the CFAP program allowed us to provide quality produce and dairy products, and we eventually arrived at a point where we could build inventory to levels that we would address any repeat of the struggles we experienced from March to July of 2020, and allow us to begin to build more healthful options. We have now distributed over 435,000 backup boxes, each one a supply of support food for families. While our percentage of donated to purchased has shifted from pre-COVID days, which was a near 50-50 relationship, our current ability to add to the purchase levels has us in a great position to continue to support those in the state that find themselves food insecure for whatever reason. Together, we have all been able to support our neighbors with nutritional food as we work through the last year. While the past year has not been without struggles and sleepless nights, it has been a privilege to work alongside people committed to the mission, both inside the Maryland Food Bank, our partners, and across the state. Thank you for that privilege. Back to you, Rachel.
Thank you, Rick. Next up, we have Sue Zavoyna with the numbers update. Sue?
Thank you, Rachel. Can you get to, there you go, thank you. As I think back to our operations from a pre-COVID perspective, the Maryland Food Bank had historically distributed around 32 million pounds of food annually. Approximately 40% of these pounds were from donated streams, 40% were purchased, and 20% came through USDA programs such as TFAP and CFSP. And when the pandemic hit, we all remember what we were facing: an expected surge in need coupled with a tight supply chain. Early on, we forecasted a decrease in our donated food source as we saw retail groceries being purchased at a record pace. The amount of food that might be available for donation was really unknown. And while donated food had historically been a staple to our feeding strategy, we were now facing two challenges. First, the volume of donated product was inconsistent from week to week. And in addition to that, the product mix was not sufficient to consistently or completely feed those facing food insecurity. And as we looked at those challenges, we understood how important it was to keep our network of partners open and operational. And in order to support that, we knew we had to shift our strategy to allow purchased food to play a bigger role. And this slide shows a visual of our food received by source of donated, purchased, and USDA over the past year. And in March and April, donated pounds actually held steady at about 35% of our pounds received. And this was the result of donations from many food service organizations that temporarily closed during the early stages of the pandemic. But as the months went by, we began to see our donated volume drop off in terms of total pounds. And beginning in August, we began to see a substantial decline in the actual pounds donated. And for the last 7 months, our donated food receipts are down 2 million pounds, which represents a 27% decrease over the prior year. Over the past year, our donated food has shifted from 40% of our feeding strategy down to 17%. And conversely, purchased food has grown from 40% to 57%. Next slide, please. Over the past year, we've distributed just under 61 million pounds of food, which is an 88% increase in the previous 12-month period. And this increase in poundage was filled in 2 ways. First, we took advantage of the USDA Produce Box program and coordinated the distribution of over 435,000 boxes of fresh produce to our network. This translated into 10.9 million pounds of food. And second, we have purchased additional pounds of food, which we made available to our network at 0 cost. Next slide. Over the past year, the Maryland Food Bank has spent $27.2 million to purchase an additional 19 million pounds of food, which is a 383% increase. We've distributed enough food to provide almost 51 million meals to Marylanders, enough to feed every Orioles fan in Camden Yards for nearly 14 seasons. Next slide. We distributed close to 600,000 grab-and-go meals to kids who were greatly impacted by school closures. If we gave out 1 meal per second, it would take 7 days to distribute those meals. We hosted 3,200 Pantry on the Go events, which equates to over 60 events a week. Cars at all of the Pantry on the Go events would stretch from Baltimore to Dallas, Texas. And we activated 204 temporary partners. As I spent time preparing for this webinar and reflecting on the pivotal moments from the past year, it was hard not to get a little emotional. And to be honest, it was hard not to get a lot emotional. Our work was hard, but so incredibly important. Thank you for answering the call when we asked you to stay open and operational. Thank you for your innovations that allowed safe food distribution. And thank you to our new partners who stepped up when the need was so great to support your fellow Marylanders. Back to you, Rachel.
Thank you, Sue. Next up, we have Carmen Delguechio, our CEO and President. Carmen?
Thanks, Rachel, and good afternoon, everybody. I'm going to echo off of Sue's remarks and hope that I can keep my emotions in check, because there is certainly a lot to be proud of, certainly with regard to the work that we've done over the last year. I want to say thanks for giving me the opportunity to join you today. It's hard to believe that there's been over 30 of these sessions, most of which I've attended. So I guess you can say I'm a long-time listener and a few-time caller. So thank you again for the opportunity to join you. I want to just say, I think I want to take a pause here for a moment and take the opportunity to celebrate. Celebrate not in the way that our work is done, because it certainly isn't, but celebrate the fact that we have accomplished a great deal. You have accomplished a great deal. If you think about the number of people we've had to serve over the last year and your ability to respond to that increased demand, you think about the creative food distributions that we had to set up to make sure we provided safe environments for people to come in. If you think about the amount of education and awareness you had to do for your communities, and perhaps the most important role that you played, frankly, is you were that level of stability, that calm in a storm that a year ago, people, nobody knew where this was going to go. There was a lot of fear. There was a lot of unknowns. And the fact that they had a place to go in their own communities where they can see a friendly face, be sure that they're going to get access to food, and provide some level of support was an incredible role that you played to helping bring a layer of calm in the communities we serve. And so we should celebrate all those. And we could not have done the work we did without you, and we could not have had the impact that we've had without all your efforts. So to echo the comments of my colleagues here, I can't thank you all enough for all you have done. and how proud I am to be affiliated with such a resilient network. If we start to look ahead a bit, the COVID has created a pretty interesting landscape for us going forward, right? We have more people who are food insecure than ever. We have a number of key drivers that we're gonna have to deal with on a go-forward basis around for those people who've lost jobs, wages and incomes. We have a looming eviction crisis that we're gonna have to deal with. And COVID has also kind of exacerbated or raised the awareness around the health disparities that our Black and Brown communities here in Maryland are facing, which is going to be another barrier to this recovery. And so what that means for us is we're going to have to begin to think differently about the work we do and the services we provide as a network. If we're serious about this notion of ending hunger, and if we are really going to make a dent in the number of people who are facing food insecurity today, we need to think differently about the work we do. And so while we're distributing food to the folks in need, we have to ask about the challenges those folks are facing as they come through the line. And then we have to we have to be prepared to offer new kinds of support for folks beyond just feeding them for today, providing them access to services that are going to help to improve their lives tomorrow. It's really just a different way of doing the work we're already doing today, a different way to help families become food insecure by connecting them to other services that are going to help them and their families become less dependent on food banks going forward. We started this work in 2019, but unfortunately 2020, the COVID pandemic interrupted that. But we're getting back to it in a number of ways. A couple examples. We're going to expand what our client services teams are offering beyond assistance with SNAP applications to begin to address other needs that we know Marylanders are facing. We're going to begin partnering with healthcare providers and higher education to add food to the mix of wraparound services that those institutions are already providing. If you think about it, if hospital patients and college students have ready access to nutritious food, that's going to improve the likelihood of improved health outcomes as well as graduation rates. Those are just a couple examples. We're also expanding our FoodWorks program. And many of you may already be aware of that. We're 11 years into that program, which provides 12 weeks of culinary training, hard skills and soft skills at no cost, so that our graduates can enter the culinary field and find meaningful jobs that can lead to careers. This is a very tangible way that we can help Marylanders get back on their feet, provide access to jobs, and provide access to income that can help prop up themselves and their families. We also know that not everybody wants to be a chef. So we're also going to be looking for other job training and reentry programs that we can partner with, so we can offer more options to folks as they look to get back in the workforce. You're going to hear more about these and other efforts as we continue this journey throughout the year. But as we look back over the past year, I wish I could say that we can declare victory, but we can't. But again, it doesn't mean we can't take the moment to celebrate. We have accomplished a lot as an organization and as a network, and each of you as our incredible partners. But we have a lot of work ahead of us to help Maryland truly recover from this pandemic. The good news is we wouldn't be here today without the highly functioning partnerships that exist. We talked about the numbers already, and the number of you who have joined our network recently, and those of which have been with us for a number of years. And on behalf of the entire team here at the Maryland Food Bank, I want to say thank you. Thank you for all you did day in and day out in the face of this pandemic. We are fully engaged in this next chapter of work that we're going to do. And I'm confident that when we host this meeting 1 year from now, we're going to look back again and be amazed of all we've accomplished and all that we're going to be able to accomplish together. Thank you very much for all you've done. And I look forward to the year ahead. Stay safe.
Thank you, Carmen. Next up, we have our Senior Vice President of Programs, Nikisha Boyer. Nikisha?
Good morning, I'm sorry. See, I'm already in the day. Good afternoon, everyone. So we are certainly fortunate to be present and to have this opportunity to reflect on the challenges, accomplishments, and opportunities that have materialized over these past 12 months. We have indeed have had some remarkable strides in our response to the pandemic, and we would not have been able to do this without the support of some extraordinary stakeholders. I'll take the liberty and start with recognizing the dynamic MFB's programs team, in which I am honored to support and coach. When I started my journey with the Maryland Food Bank last April, it wasn't long before I witnessed the amazing talents, hard work, dedication, and great resiliency in our programs team. Our team members have been consistently committed to responding to the demand, the raised expectations, and the need to pivot in mid-stride in order to help keep our network strong and positioned to meet our partners and food insecure Marylanders' needs. There have been many team challenges and changes over this fiscal year. We've lost some tenured staff and we brought on new members. Shoring up our personnel is an essential part of addressing the increased workload and to successfully accomplish the strategic planning initiatives that Carmen mentioned. So right around the holiday season in 2020, our team, like many of you, were beginning to feel the physical and emotional impact of the pandemic, both personally and professionally. It was imperative that as an organization, we needed to support our team members. Some of the assistance MFB provided to the team was the promotion of our employee assistant program services. We coordinated a mental health training facilitated by behavioral health specialists and incorporated an MFB Cares communication to share with many of the resources we presented during these calls for our own team members to access. And if COVID fatigue was not enough, a lot has happened in our society over this year alone, from the death of George Floyd last May to the recent killing of Daunte Wright, which unfortunately continues to put the world on notice that racial injustice, inequality, inequities, and racism in our country is still an epidemic. Today, just as it was during the civil rights movements in the 1950s and 60s. Last June, Carmen and I addressed this platform during one of the webinars to publicly announce our stance against the persistent racial injustices and inequities. We have been committed to embark on this organizational shift so that our entire MFB team gain the knowledge and understanding to help us apply a more equitable lens to our work and ensure that we create an inclusive and welcoming environment where everyone is seen, heard, and valued. Since that announcement, we have partnered with a diversity consultant firm to help us start this journey. To date, we have had an equity audit assessment and begun to implement recommendations. This month, we kick off our training series of for MFB's leadership teams and HR department. And soon, our quarterly all-staff diversity workshops will commence. I am pleased to work for an organization that is learning and building our capacity to rise above the status quo and challenge ourselves to do better. We have a long road ahead of us on this journey, and our MFB team is dynamic and has what it will take to move us forward together. And since the beginning of the pandemic, our partnership with the state has been critical to our ability to respond effectively and efficiently to the pandemic. As Meg mentioned, our partnership started with the Maryland's Department of Human Services Office of Energy Operations as Bethany Brown launched the first call of over 400 participants, which soon became this biweekly webinar that MFB continues to orchestrate to this day, where valuable information, best practices, safety protocols, funding opportunities, and more are shared with hundreds of listeners statewide. A sincere thank you filled with an abundance of gratitude to Bethany for pioneering this communication platform during the rapid development of COVID. And a thank you to other members of the DHS team who have participated in this webinar, such as Marcos Collins. And we are grateful for the Maryland Department of Health team, who has also played an important role in the webinar. So thank you go out to Deanne Williams, Kyle Shannon, Patricia Values, and Dr. Cliff Walsh. Now I would like to welcome Bethany Brown, Maryland's DHS Assistant Chief Division of Administrative Operations, to offer her COVID reflections. Bethany?
Hello, thank you so much for having me today. And I humbly thank you so much for those kind words. Can you hear me okay?
Yes.
Okay, great. Okay, thanks. Next slide, please. Again, I am honored to be here and share a quick look back at statewide feeding from a governmental perspective for the COVID-19 feeding response. Next slide, please. Back on March 5th of 2020, over a year ago, Governor Hogan did declare a state of emergency to further mobilize all available state resources to respond to the novel coronavirus, later called COVID-19. One of the important results of that action was that the Maryland Department of Human Services activated our state coordinating function, Human Services Group, to start coordinating with many different agencies on statewide feeding efforts, including local, state, federal, and of course the critical nonprofit agencies that we've been working with. Next slide, please. It was kind of strange in the beginning because we were really working from a very much a macro level and a micro level at the exact same time. We really had to focus on the macro, identifying funding for major vulnerable population feeding efforts statewide, really quickly determining resources that might be needed across the entire food network, and being prepared to make those asks of money and resources at the very beginning for potentially on behalf of thousands of different partners throughout the state. But at the same time, we were also engaged. We were kind of spending our mornings kind of working on that, and then nights and well into the evenings and later actually driving food packages around for people in quarantine at hotels and similar. So it's kind of just an interesting juxtaposition of the very macro and the micro at the same time. Next slide, please. There were several important things that happened early on for federal funding sources that influenced many feeding programs, and two of them are listed here: the Family First Coronavirus Response Act and the CARES Act. Next slide, please. These federal funding sources really helped to shore up existing programs, including the Supplemental Nutrition Assistance Program, and the TFAC, the Emergency Food Assistance Program, which has provided over $13 million of worth of food resources since the beginning of this event in Maryland. Next slide, please. There were also multiple feeding programs that were provided from these federal funding programs and other state and funding efforts for feeding for youth, including PEBT, which is the Pandemic Electronic Benefits Transfer Program. Eligible school children can receive temporary emergency nutrition benefits on loaded cards that are used to purchase food. I know most of you are pretty familiar with this program by now. Over 430,000 families in Maryland have been provided those benefits since the beginning of the pandemic. Schools were also closed in Maryland starting March 13th, 2020 through the end of the 2019-2020 academic year. And over 24 million meals were served to youth between March 13th and August 29th through the non-congregate meals program for children. Next slide, please. There were also multiple programs that were developed to assist with feeding seniors. Many home delivered meals programs were funded through federal funding through the Maryland Department of Aging, and the funds were granted down to local agencies. Currently, the Maryland Department of Aging is reporting that they have tracked over 7 million meals which have been provided through their affiliated networks. They've also been reporting that they've provided 400,000 meals via the restaurant initiative, which is funding for restaurants to make the meals to be available to seniors. Next slide, please. We also worked with the Maryland Department of Disabilities, the Maryland Department of Human Services, our agency, 211 Maryland Salvation Army, and of course the efforts of the food bank to partner to ensure that anyone across the entire state who called 211 and could not access a food pantry or a food bank locally could receive home delivered food. Local jurisdictions have also set up multiple food programs to assist with home delivered food, and many of the local food banks are affiliated with these efforts. Some of the highlights of some of our local jurisdiction feeding efforts include Montgomery County, which created the Food Security Task Force to enhance coordination amongst providers. They purchased food staples in bulk to support increased demand that food providers faced, including they partnered with many different organizations to repack rice and beans for distribution. There was also multiple efforts put forth to increase food capacity, improve infrastructure, and expand food capacity. Grants were used to purchase trucks, shelves, food, refrigerators, et cetera. So there were just massive efforts taken on by the Montgomery County government and all their partner agencies to increase food support in their county. Next slide, please. Caroline County was very careful to create a deliberate hub-based system to provide breakfast, lunch, and dinner meals countywide. They collaborated with many nonprofits for weekend feeding of school-aged children. They found a strong mental health component to providing food and really celebrated and capitalized on that as much as possible. And they worked very hard to ensure locally sourced food was provided also as much as possible. And they continue some of those efforts on an ongoing basis to try to shore up locally produced and resourced food. Next slide, please. And of course, Baltimore City took on a tremendous effort to ensure that their citizens were fed. They provided 8.74 million meals, 730,000 food boxes, more than that. And they provided $400 worth of cards for food purposes to 15,000 households. Next slide, please. So those are some of the highlights of some of the great local work that's been done. And there are so many examples. Every single county and jurisdiction has many, many examples. But of course, absolutely none of this could have been possible without the amazing work by the Maryland Food Bank and its very strong network of local providers. Your work has been absolutely phenomenal, and you have all partnered in every piece of what I've talked about. Every single program you touch, every single program that I mentioned is touched by the work of this large network. Our agency has had the privilege of working with many nonprofits through the years during disaster response, and the Maryland Food Bank truly stands out as extraordinary in its ability to institute massive operational changes in order to meet the challenges required for feeding Marylanders during this prolonged disaster as quickly and as compassionately as this staff has. I really agree with Meg. I remember when we started these calls, and I don't think I'll ever forget those those first calls. I think we all remember when in the beginning, and also I agree that we can't quite declare victory yet, but we can definitely declare every single person on this call one of the frontline heroes and on the frontline hero team. So we thank you all so much for all the work that has been done in the state to support Maryland feeding. Thank you so much, Rachel.
Thank you, Bethany. Next up, we have Kyle Shannon with the Maryland Department of Health. Kyle?
Hi, Rachel. Thank you again for inviting me to this call. When you asked me to do a year in review and do it in 5 minutes for COVID, that was a challenge. So, hopefully over this past several months, I've been providing, the right information, and the information that we've been providing has been helpful to assist everybody in doing the important work that you're doing. Next slide, please. And next slide. And you can go on to the next one. All right, there we go. All right, so just to kind of do some quick review, these next couple of slides are actually slides that Dr. Cliff Mitchell presented to us at the beginning of this. I remember sitting in his office early in March of 2020 and kind of reviewing this information. And he said something that really struck me. And as I think about it, he looked at us and says, this is not going to be a quick response. We're going to be in this for the long haul. And, we look at this a year later and there still certainly are some challenges that we're working through. Just as a quick review, coronaviruses are a family of viruses that cause disease in animals, humans. This includes the common cold, the SARS virus, if people remember way back from 2002, and then the Middle East Respiratory Syndrome, MERS, which occurred back in 2012. These viruses are similar to COVID-19, but COVID-19 certainly had the propensity to transmit from person to person much more efficiently than some of these other viruses that we've seen in the past. So transmission and symptoms spreads from person to person, primarily through respiratory drops. This information we use to kind of determine what was going to protect people the most. Mask use, social distancing, that sort of thing. Came from what we knew about the virus early on. Next slide, please. Just an overview of the Maryland Department of Health response. There were a lot, obviously, we didn't do this alone. Pretty much every agency within the state had a hand in assisting us with this response. We primarily coordinated with the Maryland Emergency Management Agency and all other state and federal partners to lead the response efforts. We participated in early on in a lot of conference calls and phone calls with federal and state partners to determine, some of these protections that were put in place and some of the orders that came from the governor's office. The Maryland Institute of Emergency Medical Services and MDH worked with the hospitals, local hospitals, to coordinate around surge planning to make sure that the hospitals and healthcare providers weren't getting overwhelmed. And obviously our vulnerable populations in the nursing homes, we worked a lot with those to ensure that outbreaks were being responded to efficiently, and we were protecting those vulnerable populations the best that we could. And then there's a lot of information that was coming in and going out from the department on, the best way to keep people safe. Next slide, please. So my bureau, the Environmental Health Bureau, we worked a lot with partners and businesses to provide guidance, particularly as businesses and organizations were closing and then reopening, and what during those reopening phases we're going to keep people safe as people were getting out and about. And a lot of communication with industry partners, the FDA, and then state and regional partners, and then also our local health department partners that were receiving a lot of calls from the public for guidance. Next slide, please. So I'll go through this really quick. We use this was a timeline that we created for a after action review that we've done to kind of wrap up 2020 to determine, what our agency, in particular our bureau, did well, what things we need to do better, and if there's things that needed to be done better, what is the plan to ensure that the next time we do it in a more efficient way. So this starts back in January. January and February is where there was a lot of information coming from the World Health Organization and the CDC about, this virus that was circulating in China. And then on February 3rd, the US declared a public health emergency due to this virus. Next slide, please. So as we got into March, March 5th is probably one of those days a lot of people remember. This is where the first 3 Maryland residents tested positive, and Governor Hogan declared a state of emergency and catastrophic health emergency. A lot of things went into place at this point in time, and a lot of guidance on social distancing. As many folks remember, personal protective equipment such as masks were pretty much non-existent, except for in the healthcare community. So on March 30th, Governor Hogan issued a stay-at-home order. Next slide, please. All right. So, we started to see cases certainly go up. On May 2nd, we had 24,000 cases. And then as we started getting closer to the summer, we started to see a little bit of, decline in cases, decline in percent positivity. And that's when things started to reopen a little bit as we got into the summer months. Next slide, please. So we started getting into July. There was some more reopening in July and August. There was some discussion about schools starting to plan to reopen. Obviously, there was a lot of shifting in that as we got into the fall months, where we started to see a little bit of a increase in cases. That's kind of where we started to see that second major surge. So next slide, please. September and October, again, I think we started to see a little bit of an increase more closer to the end of October. We see this in October 27th, Maryland had 900 cases, which was the single highest day since increase since early August. So next slide, please. This slide's very busy because this is where we started again seeing that second major surge. There was a lot of information around the holidays where, you know, people were being asked to not travel, that if they could, to stay home during Thanksgiving and Christmas. But we also started to get a little bit of good news in the sense that the vaccines, the first two vaccines received their emergency use authorizations by the FDA on December 11th and December 18th. And then that December 31st just kind of wrapped up the year. We had 76,662 cases since the beginning of the pandemic. And at that point in time, the percent positivity rate was over 8. Next slide, please. All right, January, we were still seeing some increases, but we were also starting to work with the vaccine distribution plan. Phase 1A had started at the end of December, and we had started to get a lot of those folks identified in 1A, such as the healthcare community, vaccinated. And then in the end of February, the third vaccine, which we'll talk a little bit about later, received its emergency use authorization. And then we started to also see some of the variants start to pop up in the US, but also in Maryland. Many folks have seen on the news the UK variant, which is one of the predominant variants right now that is circulating in the United States, the South African variant, and then the Brazilian variant at the in the mid-February. Next slide, please. All right, so we see this March 5th is the 1-year anniversary where cases were first reported in Maryland. We started to work our way through some of the additional phases in phase 1. And then on March 25th, we entered into phase 2 of the state vaccination plan. Next slide, please. So I know a lot of times I refer to this data that's on our website as I gave my updates. So a lot of this data was used by obviously the department and the governor's office to, you know, determine where we're at and what we needed to do different to keep people safe. You know, as we started to see the percent positivity rate raise, a lot of times the decisions were made to, you know, put specific orders back in play, whether it was, you know, having an effect on businesses and reducing the capacity in restaurants and other businesses, or on the other end of that, as we started to see it decline, making the determination and recommendation to you know, open those businesses back up. Next slide, please. So these are just a couple of current updates. Many of you have probably seen in the news, the Maryland Department of Health kind of made a statement on the Johnson & Johnson COVID vaccine. The FDA, Food and Drug Administration, and the Center for Disease Control and Prevention has made a recommendation out of abundance of caution to put a hold on that vaccine due to some cases of adverse reaction related to those vaccines. So as that changes and more information comes out, I'll certainly share that on additional webinars. Next slide, please. And I just wanted to talk a little bit about the Maryland Vaccine Equity Task Force. There is a task force that the governor has activated. There is some information, and I think I shared the link to the website. There's some additional information on this website that if there is a need for an organization to ask questions of the task force or to request actions by the task force, there is a document on there in order to do that. So if anybody has any questions, feel free to let me know, but that website has a lot of good information on it if anybody would like to refer to it. Next slide, please. And just some acknowledgements. I know Dee was very active with the group early on. I've learned a lot from Dee, and I still talk to her, so she's doing very well in her new job. She's with Johns Hopkins now, and she always asks about the group and how the group is doing. And then Dr. Cliff Mitchell and Patricia Walls. And I think that's all I have for today.
Okay, thank you, Kyle. We will add the link to the Vaccine Equity website to the resources page after the call. Next up, we have Jennifer Small, our Senior Regional Program Director of Eastern Shore and TFAB. Jennifer?
Thank you, Rachel. I would like to take this opportunity to both acknowledge and thank the many guests who have presented as part of our webinars over the past year. Those of you who have highlighted and are also shown here on this slide. Each of you have provided valuable information and resources for our partners and for those that they serve during a very critical and challenging time. We know that the breadth of topics covered was not only appreciated, but valued by our partners and equally valued by the Maryland Food Bank. Today, we are also here to express our deepest gratitude and immeasurable pride in our partner network across the state. Not only have you been doing this work for many years through great dedication and an unconditional heart, but so too with this past year, you were tested in so many of the same ways that we were. You faced extraordinary and unexpected circumstances. You lost volunteers who were vulnerable and unable to continue active participation. You lost sources of funding as church services closed and fundraising events were canceled. You lost the safety and security of operating within the four walls of your facilities. You lost access to regular food sources. Demand for food support increased. Your levels of fear rose. And as the emotional weight of this work grew, regardless of those very challenges, you stood tall, feet firm, and you continue to stand and answer the call. We have been truly amazed by the resilience, the innovation, the passion of our network. Never did you work slow, but it has surely pivoted in ways to best meet the needs of your communities during this crisis. You've offered drive-through distributions in pre-packed boxes. You've experimented with home delivery, meeting the needs of our homebound and those who are suffering with COVID. There were new sources of funding that arose, new sources of food, and we were there with you every step of the way. This past year was an incredibly challenging one, but as we look back, there are silver linings around all of us. You, our frontline essential workers, have made us so proud. This network is stronger than ever, and we are so lucky to be in partnership as we journey the months and the years ahead. Thank you so much for all of your work. Rachel.
Thank you, Jennifer. Next up, we have Emily Alt. Emily?
Thank you, and thank you so much, Jennifer. I just want to echo that appreciation for our incredible partner network and the work you've all done over the past year. I want to give special words of thanks and appreciation for those partners who took time out of their already overloaded schedules to come onto one of our webinars and present. Your presentations were informative, inspiring, and important. You were able to share real-time, real-life experiences, best practices, stories, and information with your fellow food assistance providers. The information you shared was powerful and made a real difference. We heard an incredible amount of positive feedback about what your presentations meant to other partners trying to navigate the changing landscape. Rachel Neal from Gedco Cares Food Pantry, Krista Pettit from Haven Ministries, Ann Heiser-Bazzelli from the Brooklyn Park Healthy Food Pantry, George E. Mitchell from the Langston Hughes Community Resource Center, Bruce Livingston from Heritage Baptist Church, Stephanie Howley from the Westminster Rescue Mission, and Mike Reese and Helene Ridenauer from Tabitha's Table. We know that we cannot fully appreciate the accomplishments of our partners over the past year without acknowledging and reflecting on some of the volunteers and staff of our partners who are no longer with us. We have lost some very special members of our partner family this year from various causes. These individuals dedicated their lives to serving their communities. They were leaders, champions, and fighters. We learned from them and were constantly inspired by them. We will always remember them. George E. Mitchell, Langston Hughes Community Resource Center, Janet Pack, Asbury Church Assistance Network, Fred Nagel, Weekend Backpacks for Kids, Tommy Mason, Snow Hill Ecumenical Food Pantry, Pastor Kathleen Moore, Helping Hands Outreach Ministries, and Bernice Bishop, Women Empowering Women. And finally, we want to remember and honor two very special members of our MFB family who we lost this year, Michelle Nowak and Marvin Webb. Michelle was with Maryland Food Bank at our Baltimore office for nearly 9 years. She had a deep passion for our mission, for our partners, and for her colleagues. Marvin Webb served as a volunteer coordinator for over 5 years at the Salisbury branch of the Maryland Food Bank. Marvin was a dedicated and valued member of our MFB family. The deep commitment that both Michelle and Marvin had to serving others set a beautiful example for all of us at the Maryland Food Bank, and it continues to inspire us and drive us to do the work that we do. Rachel?
Thank you, Emily and Jennifer. While we think of those that we've lost over the past year, we can also reflect on all of the work we've done together. We will close this webinar with a short video. Thank you to all the presenters who have joined us on these calls, and to the webinar team and all of the guest panelists. We will see you again for the April 29th webinar. Thank you and have a great day.
Tells me I can't share one thing.
Throughout COVID-19, you, our valued partners, stayed open, stayed safe, and stayed focused on feeding hungry Marylanders. On behalf of the people of Maryland, thank you for your incredible work.
Good morning, Maryland Food Bank team. I'm Regina Brantley from Life Church Ministries. Over in South Baltimore, we serve the Brooklyn area, Curtis Bay, Northern Anne Arundel County. So this morning, I am at the Maryland Food Bank gathering and preparing for Pantry Day, which is on Tuesday. And we have a ton of good stuff, some fruits and vegetables. I was more happy today to see the veggies because we're in a food desert area, and that's a commodity that a lot of our folks don't take advantage of buying with their resources. So we like to be able to provide fruits and veggies. I also found that made me super happy was some small clementine oranges. We like to have fruit for our homeless. So today, and every time we come here to the Maryland Food Bank, it's a big deal for us because we're able to gather a lot more food that we can give out to our community to help fill their bags a little more. So thank you, Maryland Food Bank. We love it. We love the partnership, and we love being able to partner with you to be able to stay open during this whole COVID-19 epidemic.
People really need food. You know, with people out of work, 6.6 million in the country filed for unemployment. People need help, and that's what we're here for. I mean, we put ourselves on the front line. I got my buddies here. This is Sonny, Mr. Brooks. We put ourselves on the front line to come there and get this stuff and distribute it. And we got a lot of good people working around me, man, and that's the key.
The grab-and-go meals have been working perfectly. We have a few kids that come through with their parents and pick up a few meals. After they get their meals, we pass them out to the community. Our kids really appreciate it. Without these meals, we have no clue how our elementary school students would travel across probably about a 2-mile radius to get food from Bates Middle School. It's very, very helpful for a lot of families.
When all of this started happening, our phone volume, where we were answering calls from patients just about things like food insecurity and utilities, was almost 5 times the normal rate that we receive, and much of that was around food. So they really thought, you know, this clinic is the place that's going to be able to help me with this. And when we were able to say in that moment, you know what, we actually have a pantry in the clinic. We can meet you outside the front of the doors right now if you're able to come on down, or we can even help with transportation. And you can just hear the relief in their voice.
Hi, I have the food we talked about.
We started this in the middle of a pandemic, and how quickly we actually changed our plans when this started. It's not just patients that we're serving through our partnership with the food bank, but we're really serving an incredible number of our own staff.
A lot of the branches during the summertime are already offering summer lunches. And unfortunately, due to COVID, we haven't been able to offer it like we usually do in-house. So we were able to partner with the Maryland Food Bank to still fill that community need to make sure the kids still got food.
We're outside today because Kingdom Celebration Center has partnered with Maryland Food Bank and Anne Arundel County Partnership for Youth, Families, and Children to serve the community.
Since COVID-19 began, more Marylanders than ever are facing hunger, many for the first time. Through it all, the Maryland Food Bank has been here, our statewide network of community partners, alongside our volunteers and supporters, are working to ensure no one in our state goes hungry. But our work is far from done. Our neighbors will face the effects of this pandemic for months, even years to come. It will take all of us working together to give all Marylanders access to nutritious food.
All right, thanks everyone for attending this special edition of the webinar. Rachel, do you have anything else to say?
No, the video was a wrap. Thank you, everyone. We'll see you on the 29th.